Well, everyone, welcome to a quick demo of PracticeIQ by Practice by Numbers. This video is going to give you high-level features, high-level introduction of the features that are in the PracticeIQ software. So let's click on PracticeIQ right here. Now, what does this software do? How does this help your practice? This software as a service connects with your practice management system, Eaglesoft, Dentrix, and OpenDL, and others will be coming shortly. Brings the data together from your practice management system, connects with your financial system, and creates this one-stop shop to manage the health of your business and the performance of your employees. As an example, here is a custom dashboard for all the hygienists in this particular office, looking at the month of March and showing which ones pre-appointed the patients for their next appointment or not. And with a click of a button, I can go back 1 month and take a look which of these hygienists pre-appointed at a higher percentage. And this is for February, and we can go back even 1 month more to see if they are pre-appointing or not. And with this, you can bring accountability to each and every employee in your office. PracticeIQ contains over 300 key performance indicators, and every indicator has the data behind. For example, in this particular office, there has been 3% failed appointments and 8% canceled appointments. And if I want to know which ones were failed or canceled, all I have to do is look at the data behind, and it'll give me the list of every single appointment that was either canceled or failed, and I can do an analysis to find out which of these appointments were rebooked and which was not. PracticeIQ also contains provider-level details, be an owner dentist, an associate, a hygienist, or a specialist. In this view, we're looking at a doctor for the month of January in this practice, and it's splitting it up based on how much production was done by this particular doctor in this office. And you can look at production, you can drill down to any level. You can look at production per hour, production per day, how much scheduled utilization they had, and you can look at every single patient that they saw. Okay? And with a click of a button, you can go ahead and look at last 12 months of data as easily as looking at the last month of data or the current month of data. And with that, you can also do in-depth analysis of their treatment planning performance. And here is treatment planning performance for this particular doctor for the last 12 months. And this is showing how much treatment was presented. It's aggregating the total amount that was presented versus that was accepted, making the management of providers in your office a breeze. With the integration of QuickBooks Online, you can now track all your financial data in a unified dashboard that can help you manage your office on a day-to-day basis without waiting for reports from your CPAs and your bookkeepers. Here we're looking at profit and loss or overhead calculation for the last 12 months for this dental practice. And here it shows me 49%, 26% came from payroll, 5% from supplies. And it contains quite a bit more details in terms of what is the break-even point, how much was collected in your practice management system versus how much was deposited. And all of this is very important for you to be able to track, and also understanding what is your overhead per hour, how much of that is fixed versus how much of that is variable. With the integration of financial management system, it gives you a holistic picture of your practice, which would have not been possible otherwise. Revenue IQ is included as your subscription with PracticeIQ. With Revenue IQ, it's easy to search for hidden revenue. For example, finding patients who never completed their comprehensive exam is as simple as clicking 2 buttons. Looking for all pending treatment in the office is pretty straightforward as well. And with the system, you can go ahead and follow up on every single patient, and you can give the patient a call and update the reason why they did not schedule right here in the software. You can implement recall mechanism, a reactivation program, search for canceled appointments that were not rescheduled, or search for pre-appointments that did not get scheduled. It also makes following up with patients easy and structured. For example, if these two patients tell you that they need to be called back in a month for them to schedule their appointments, all you have to do is select the patients and create a task and assign it to one of your employees and create a task for next month. These tasks will show up either under PracticeIQ or they will show up on your homepage. With our innovative cloud-based system, we hope the software will help manage your practice and make it easy for you to be able to run 1, 2, or 20 practices at the same time. Thank you very much.